My mission is to protect the most vulnerable, because I'll tell you, as a heart surgeon, the most expensive care is bad care. You got to pay the person who's doing a bad job. You got to pay someone else who's capable to fix the problem, and you got to pay for the complications. And there's so many things we can do to improve care in America. And folks watch this program are probably witnessing and pretty good testimonials out there about what has been done in the past that's not worked well. But here's the good news. We can empower beneficiaries, give you tools, and that's coming down the pike at you. We can make sure providers have better opportunities and incentivize them to do the right thing, because oftentimes in CMS we've unfortunately gotten folks to do things wrong because we pay them for doing things incorrectly. But right now my main focus, without any question, is to wage a war on fraud, waste, and abuse. Okay. Because that's what's required. All hands on deck. It's a massive issue. Hundreds of billions of dollars potentially out there. Not all of it's going to be collected at once, but we've got a war room right now focused very much on things that are going to really bother you. If you thought USAID was a problem, some of the issues that we're discovering, some of the things that CMS has been funding through Medicare and Medicaid and the exchanges will bring a little shiver to you.
We're going to have growth like you've never seen before.
That's true. Yeah, you said that.
We're going to have growth. I'm not going to touch Social Security, Medicare, Medicaid. Now, we're going to get fraud out of there. You see where I talk about it all the time. We have people 250 years old and all, tremendous fraud. But that has nothing to do with that. We're going to get the fraud out, and everybody wants us to get the fraud out, and therefore you'll make it better. But we're going to have tremendous growth. When you look at all of the car companies that are now coming into the United States, and they've been announcing, like on a daily basis, they're going to build their plants and they're going to create tremendous numbers of jobs and so many other things. And I'm doing something else that I think is very exciting. Maybe I'm wrong. A gold card. For $5 million, you buy a path to citizenship in this country. We'll see. I believe that Apple and all these companies that can't get people to come out of college and come because they get thrown out. Think of it. You graduate number one at the Wharton School of Finance or Harvard or Stanford, and you get thrown out of the country. You can't stay more than one day. And they want to hire these people, but they can't. They've complained to me about it. Now they can buy a gold card, and they can take that gold card and make it a part of their deal to get these top students. No different than an athlete, like a bonus. It's a signing bonus. And you're going to have a lot of people buy that. You're going to have a lot of companies buying gold cards. So for $5 million now, it's a lot of money when you add it up if we sell a lot of them.
Yeah.
If we don't, it's nothing ventured, nothing lost. But I think it's going to be very successful. You can't get a green card. A green card, this would be a green card on steroids. This would be much better than a green card.
Chairman Crapo, Ranking Member Wyden, thank you very much for inviting me to appear in front of this committee today. I've met with everybody on this committee at one point or another, and I'm hoping some of those conversations will inform the committee hearing. I want to thank President Trump for his passionate desire to make America healthy again and for nominating me to support that vision. I want to thank Secretary Kennedy for having the confidence in my capacity to make a meaningful and measurable difference in the health and well-being of the American people. Let me start off with one simple premise. All great societies protect their most vulnerable. And I would argue we are a great people. With that in mind, I commit to doing whatever I can, working tirelessly to ensure that CMS provides Americans with access to superb care, especially Americans who are most vulnerable, our young, our disabled, and our elderly. For me, this commitment has been a lifelong passion. My physician father, when he came here, when he immigrated, saw America as a beacon of hope, a land of opportunity where everyone's decisions mattered. That imbued in me a confidence that I mattered, that I had agency. For example, I was a student athlete at Harvard, Senator Wyden, like you. That was the original Make America Healthy Again concept, that you just would work hard, play hard, eat well, and watch your body thrive. But because of my experience in college, I was surprised when I matriculated at the University of Pennsylvania in medical school that there was no nutrition class. So because I thought I had agency, I ran for school president, I won, and I created that class. I became, as well, a student at the Wharton Business School, And while there, I learned the skills necessary to manage large organizations like at CMS, where we have nearly 7,000 folks, hardworking career civil servants, and 40,000 outside contractors involved with the delivery of our services. Next, I began my career at Columbia University. And for those of you who don't know where Columbia, the medical school is, it's in uptown Manhattan in an area called Spanish Harlem. At the time I was training, it was the murder capital of the world, an area heavily populated by Medicaid patients. And I saw firsthand how our services, our healthcare system, underserved these communities. So I went to work. I began developing high-tech solutions, life-saving medical breakthroughs, ranging from mechanical hearts to the mitra clip, which is a small device you can put into the heart without stopping the heart that fixes heart valves, and it saves lives. In one large study, 50% reduction in death at half the price. Those are the kinds of advances that I wanted to be involved in. But I also pushed for low-tech solutions, like getting my patients to use preventive strategies, healthier lifestyles in order to recover from the heart surgery that I was often performing on them. And then Lisa, my wife, and I started HealthCore, which is a teen foundation which has touched the lives of millions of Americans over the last 20 years. Senator Bennett working in schools, as we discussed in your office, tirelessly trying to get young, energetic kids to play a role, college graduates, in the well-being of kids just a few years younger than teenagers. And all along, I was working hard to publish what I found. In fact, publishing hundreds of peer-reviewed academic articles in some of our top journals, a bunch of New York Times best-selling books, as Senator Crapo mentioned, and all of these culminated in the creation of the Dr. Oz Show. We hosted health advocates from all walks of life, and we did it well, which is why we won 10 Emmy Awards for outstanding work over the 13 years of the program. I share my story with you for a simple reason, to highlight that everything I have done in my life, educationally and professionally, has prepared me for this precise moment in time, which I believe offers a monumental opportunity and a challenge for us at CMS. My TV audience has heard me say this many times, but many of you are too busy to watch television, so I'll repeat it, that I believe that a physician has a responsibility to tell patients what they need to know, even if the message is uncomfortable. So here's some painful truths that should concern everyone in this room. I'll list them quickly. Healthcare expenditures are growing 2 to 3% faster than our economy. Not sustainable. The Medicare Trust Fund will be insolvent within a decade. That's the 2.9% taken out of your paycheck. Medicaid is the number one expense item in most states, consuming 30% of those state budgets, and that's crowding out essential services like schools and public safety that many of you spent your careers trying to develop. A healthcare cost per person in this country is twice that of other developed nations. So it's not just about the money. We're already putting twice as much money into the system. Why is it costing us so much? Because of chronic disease. And those chronic diseases, and we made it easy to be sick in America, are linked to poor lifestyle choices, and they drive 3/4 of the $1.7 trillion that CMS spends a year to support Americans' health. 43% of Americans are obese. That's the major driver of those lifestyle chronic morbidities. That's quadrupled since I was in college. More importantly, we're twice as obese as Europeans. We're 9 times as obese as the Japanese. And 3/4 of our young people cannot even qualify for military service. Our maternal mortality rate, and I want to hammer this point home because we talked about it, and Senator Hassan, we talked about this, well, she stepped out, but she was there a second ago, it puts us in dead last place behind 50 other countries. Maternal mortality rate, women dying during childbirth. Medical errors, number 3 cause of death in America. These are some of the reasons why our life expectancy is now 5 years shorter than comparable countries. This public health crisis threatens our national security. Why? Because it adds to the national debt that is defeating us from within, crowding out other essential services. And we are, in addition, witnessing fellow Americans suffering needlessly, which I believe is a moral failing. As a heart surgeon, I can attest that the most expensive care we give is bad care. You pay to do the wrong thing, you pay to fix what was done wrong, then you pay to deal with all the complications. It's immoral, it's wrong, and it's expensive. We have a generational opportunity to fix our healthcare system and help people stay healthy for for longer. That's why President Trump wants to love and cherish Medicare and Medicaid, because he believes every American should get the care they want, need, and deserve. Now, to achieve this mission, CMS should work with Congress to find efficiencies that can help stabilize our insurance markets, which will make it easier and more affordable for Americans to adopt healthy lifestyles. I would argue, I know you all agree, America is too great a nation for small dreams. So here's some big ideas. I'm going to limit it to 3 so I can get to the questions that I want to pursue if I'm confirmed by the Senate. First, we should empower beneficiaries with better tools and more transparency so the American people can better navigate their health as well as dealing with the complex healthcare system we have created for them. As an example, I think President Trump's executive order on transparency shifts power to the American people. Let's make America great again and make it healthy again by informing people so they can be in charge of their well-being. Second, we should incentivize doctors and all healthcare providers to optimize care, but we have to do that with real-time information while they're taking care of patients and within their workflow. Artificial intelligence, I believe, can help. It can liberate doctors and nurses from all the paperwork, which, by the way, is as much time they spend on paperwork as taking care of patients. They should focus on patients as better use of their time. And third, let's be aggressive in modernizing our tools to reduce fraud, waste, and abuse. This will stop unscrupulous people from stealing from vulnerable Americans and extend the life of the Medicare Trust Fund. I ask your permission to start sprinting after these goals so together we can provide access to better care, deliver better outcomes, and make America healthy again. I look forward to your questions, and I pray for your support. Thank you, sir.
Medicare, Medicaid, these programs. We are focused on saving Medicaid. That's what we've got to do. That's the existential threat, that you spend it into the ground and we don't have the resources to take care of our most vulnerable. I'm sitting right now in the Humphreys building, which is the Health and Human Services building. Bobby Kennedy and I basically live here now. If you walk in the building, there's a quote from Hubert Humphrey. It says it's a moral obligation of government to take care of people who are in the dawn of life, children, people in the twilight of life, mature seniors, and people who are in the shadows, those with disabilities. To do that, you have got to make the system work better. And Democrats should be cheering us on because we're going after problems that have plagued the system that people have not dealt with for the last 4 years. I'll give you a couple examples, Bill, simple ones. $1 billion spent, Medicare money, taxpayer money that should have gone to impoverished children and seniors struggling with the illnesses that you get when you get older. And this $1 billion went because people were registered in multiple states on Medicaid at once. So you're paying a lot of states, even though they're not living in those states anymore. We've got $200 million spent on housekeeping services. Is that part of the charge of Medicaid? $10 million spent on student loans from Medicaid. That could go to saving people who have sickle cell anemia with gene therapy that's remarkably effective in completely reversing a disease. $3 million on DEI, and another $11 million on labor unions' child care benefits. I mean, come on. At a certain point, you look up and you say, you must be kidding. How can someone not have dealt this? Last year, almost 250,000 people were registered in the marketplaces who shouldn't have been.
So DOGE goes in. What's the expectation for savings from DOGE? Give us a number today based on $1.5 trillion in spending.
We've already discovered, just since I've been here, and even before, since the inauguration, tens of billions of dollars that is of fraud easily taken back. We just stopped recently a couple $100 million going out the door that would have actually been taken by folks, and who knows where they are taking the money when they get it. These people are not involved in legitimate activities. So the $31 million that I know of last week is a great example of this. We stopped the money by using new technology, by modernizing how Medicare and Medicaid works from even leaving the building because we knew something was fishy about these bills. And these aren't just small little mistakes. These are organized criminal efforts to hurt our country, some of them launched by foreign countries. So these are issues we want to get into the weeds on, and that's why we have this war room. And before I forget, Bill, this is important. This is all hands on deck. If you have a tip, call us at 1-800-HHS-TIPS or cms.gov/fraud.